Welcome to How to Make Tampa Bay More Autism Friendly. What is autism? ASD, also known as autism spectrum disorder, is characterized by the qualitative impairments in social communication and a restrained and/or repetitive pattern of behaviors, interests, or activities. Approximately 1 in every 54 children in the USA can be diagnosed with ASD, which can also be recognized as early as ages 2, but usually detected after age 4. Psychological interventions as well as therapy have been successfully adapted for autistic children, and Tampa Bay specifically could greatly benefit from learning more about this. Why do we want to help? Autistic people require certain adaptations to meet their needs. Therapists and psychologists in Tampa Bay can improve the lives of those with autism and make their therapy sessions more accommodating for their needs. There is also a major lack of urgency to help diagnose autism in many cities around the U.S., but Tampa residents struggle enough to where a newspaper was actually published. Being autistic in Florida means delayed diagnosis, delayed therapy. To see autistic people and families not being able to receive the help and support that they need is extremely frustrating and disappointing. This lack of therapy availability as well as urgency is a major reason why our community should demand a major change. What type of therapy can help my autistic child? It should first be understood that every child is different and what works for one child will not always work for another. There are many different therapies available for children and/or adults to try. Some therapies are, but not limited to, one-on-one CBT therapy, play therapy, occupational therapy, applied behavior analysis, also known as ABA analysis therapy, and sensory integration therapy. One-on-one CBT therapy, also known as cognitive behavioral therapy, is a form of psychological treatment that has been effective for a range of problems including depression, anxiety disorders, eating disorders, as well as severe mental illness. For autism, however, one-on-one CBT-based psychotherapy has several unique advantages of its own, including the opportunity for individualization of the intervention to each child. It has been noted that CBT may be a promising general treatment modality for school-age children with autism spectrum disorder. Play therapy. All children learn through play. Developing children use play to build both physical and social skills. Autistic children, however, may play in different ways. They are more likely to play alone, and their play is often seen as repetitive, with no goal in mind. According to the National Library of Medicine, play therapy is the pleasurable physical or mental activity that enhances the child's skills involving negotiation abilities, problem solving, manual dexterity, sharing, making, and working within a group. Many sources state that play therapy is very effective among children with autism. Play therapy allows an autistic child to show how they play comfortably and allows parents and or guardians to better understand or relate to their child when they get to physically see them playing and solving problems. Occupational therapy. Occupational therapy intervention is a type of therapy that involves assessing and encouraging everyday activities as well as occupations. Occupational therapy focuses on play skills, learning strategies, as well as self-care. Occupational therapists evaluate the current developmental levels of children with autism, aiming to improve their ability to self-regulate emotions and participate in social interactions. This way, children with autism can better regulate emotions and overall live a happier life and have a greater sense of security. ABA, Applied Behavior Analysis Therapy, is commonly prescribed to children with autism. ABA is a type of interpersonal therapy in which a child works with a therapist one-on-one. ABA functions as a compassionate approach based on consumer preference. ABA therapy focuses on teaching necessary skills as well as stopping dangerous behaviors rather than preventing harmless self-stimulatory behaviors, also known as STIMs. ABA therapists work with autistic people to improve their communication, language, and social skills. Sensory integration therapy. Sensory integration describes the processes in the brain that allow people to take information they receive from their five senses, organize it, and then respond appropriately. Children who are diagnosed with ASD can benefit from combating their sensory processing problems with something like sensory integration therapy. An example of sensory integration therapy would be using, but not limited to, weighted vests, swings, trampolines, slides, and deep pressure. Scientific studies indicate that those diagnosed with ASD are more likely to have sensory processing issues, so this means that SIT could definitely benefit them. However, sensory integration therapy is a newer form of therapy and does not have that much research to back it up, but it is a great idea. Tips for interacting with children with autism. Have patience. It often takes a child with ASD longer to process information. You may need to slow down your conversation to their speed. Be persistent but resilient. Do not let your feelings get hurt if the child does not respond to you as you'd like. This can go for therapy as well as just a face-to-face conversation with someone you see at the store. Autistic children as well as adults can be blunt with their responses, and it should not be taken personally. Ignore irritating attention-getting behavior. A child with ASD may act badly at times to get you to focus on them. Ignoring this behavior is the best way to prevent it, whereas acknowledging it could encourage it. Be affectionate and respectful. This should go towards everybody, autistic or not. Children with ASD often need a hug, just like any other child. Sometimes they need this much more than other children. However, some children do not like to be touched at all. Even a light contact can distress them. Respect personal space and never force any physical affection on anyone.